Hello and welcome to KCS Connects. My name is Jack Miller. I'm one of the directors of Key Clinical Skills. This is our way of connecting you to research that we believe will positively impact on your physiotherapy practice. This edition of KCS Connects is an article published in the Spine Journal in 2019. And the study was done by the Wakayama Medical University group from Japan. And it looks at supervised physical therapy versus a home exercise program for patients with lumbar spinal stenosis. And it's a randomized controlled trial study. Now, just to help us appreciate the background a little bit, a study done by Jensen, a systematic review of 41 different papers, shows that if we use a clinical diagnosis, lumbar spinal stenosis runs at roughly 11% in the general population, 29% in primary care, and up to 39% in secondary care. Well, why would we use a clinical diagnosis? Well, the numbers below show us that if we use imaging in an asymptomatic population, in the general population, it can run up to 15, primary care 32, and secondary care 41%. And again, these are in asymptomatic individuals. Graphics over on your right-hand side. Let's look at the top one there for a moment. So the prevalence of spinal stenosis, again, peaks out at that 70 to 79-year-old age group, doesn't it? And if we glance down to the graphic below from Health Canada, then we see very clearly Canada's aging population, those over the age of 65, are only going to continue to grow right through to 2080. Now, lumbar spinal stenosis is characterized by leg dominant pain, not back pain, leg pain, brought on particularly by walking, generally eased by sitting, and it can significantly limit individuals' functional abilities. Exercise has been demonstrated in the past to be of significant value, both in controlling symptoms as well as improving function in patients with lumbar spinal stenosis. The question is, do they need to be the exercise supervised, or can they just be given a home program? So this particular study was a single-blind, randomized control, open-label study. They had 86 subjects, a mean age 72.7 years. That fits right into that typical demographic, doesn't it? And they had both clinical as well as radiological evidence of lumbar spinal stenosis. And the symptoms had to be ongoing for at least 3 months. And they were randomly assigned into one of two different groups, either supervised physiotherapy, which we'll look at in a moment, or an independent home program. Now, the supervised physiotherapy, the patients attended twice weekly for 6 weeks, and they received an impairment-based approach of manual therapy to the hips and lumbar spine, stretching, supervised strengthening exercises, and aerobic conditioning that can include both cycling as well as body weight supported treadmill walking. Now, the results were that at the 6-week mark, compared to a home exercise independent program, the physiotherapy supervised group had better outcomes for the Zurich claudication questionnaire as regards to symptom severity, physical function, and the overall satisfaction of the individuals as well. Patients also had greater walking distance and less scores on numeric pain rating. If they used the Japanese Orthopedic Association back pain evaluation questionnaire, then again, the supervised group had better pain-related disorders outcomes, lumbar dysfunction, and gait disturbance. And if we use the SF-36, again, the supervised group had better outcomes for physical function and general health, and overall increased their daily steps. So basically, this shows us very clearly that a supervised physiotherapy program that is inclusive of education, an impairment-based manual therapy program, trunk strengthening, and aerobic conditioning does result in its significant improvements in both function as well as pain compared to an independent home program. Now, if you'd like to learn more about this particular study, come visit us at www.keyclinskills.ca, or come visit us at our library of research reviews, where we have this and several other papers that are now reviewed for your pleasure. And if you'd like to learn more about managing lumbar spinal stenosis, we have our self-treatment exercise program, Stenosis Steps. And that's included in our Managing Spinal Stenosis online education program. And that again can be found at www.keyclinskills.ca. Thanks for your time.